Now, every person's case of Achilles tendonitis or tendinopathy is usually unique, and there are several factors that can influence how long your healing takes. So in this video, we're going to look at the typical healing times you can expect, but I'm also going to discuss the factors that can either prolong your healing or make it shorter. I've put chapters in the description of this video if you want to jump to the relevant sections, because it is going to be quite a long one, so have a look at that as well. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment of your Achilles injuries. Have a look at the description of this video if you want a link to our website. Let's first take a look at what factors can actually influence your recovery time. Now, there's about 9 different factors that can either prolong or decrease your recovery time. So the first is, what actually caused your case of Achilles tendonitis? And this is important because if your tendonitis was caused by something like fluoroquinolone antibiotics, that actually affects your body's ability to repair your tendon and to produce new collagen fibers. And that type of tendonitis usually takes a lot longer to recover than normal tendonitis caused by overuse. If you want to know more about the causes, I've really explained them all in detail and how it affects the body in a different video, and I'll put a link to that video in the description of this one. The second factor that influences your recovery time is how long you wait before you actually start a proper treatment plan for your tendonitis. This is important because tendonitis follows 3 different steps depending on how you treat it. When your tendon first becomes injured and painful, it may be super painful, but actually there's not a lot of structural damage going inside the tendon. It's just really irritated and painful. If you give it the correct treatment at this period, it takes about anywhere between 8 and 12 weeks to fully recover. However, what the research is showing is if you kind of neglect the tendon and it drags on for several weeks, usually months, that then actually causes structural changes to happen inside the tendon. And to get those structural changes to reverse and repair takes months and months and months. So depending on how long you start the correct treatment plan, that can really influence your recovery time. Then other medical conditions can affect it. So anything that affects the body's ability to heal itself, like diabetes, for instance, can have an effect on your healing time. Number 4 is the menopause. So when we're entering perimenopause or menopause, the body's estrogen levels drop. Now, estrogen is in charge of producing new collagen fibers and strengthening collagen fibers. Excuse me. And collagen fibers are the main building blocks of your tendons. So if you don't have the right estrogen levels for you, your body will struggle to repair, and it may be a little bit slower. Taking hormone replacement therapy may help, but we've done a whole video about that, and you can find that in the description of this video. There are certain medications that also influences your body's ability to repair tendons. And 2 of the most common types are statins. So statins are often prescribed for high cholesterol or if you've had heart disease. And it's really important to not just stop them if you're watching this video. Rather have a discussion with your doctor, because it can be dangerous to just stop medication without actually discussing it with your doctor. Then the second is corticosteroids. Now, corticosteroids are often prescribed as treatment for Achilles tendonitis, which is not advised through the research, because although corticosteroids can reduce your pain and make it feel more comfortable, they actually affect your tendon health in the long run and may increase your risk of rupture. So those 2 medications are definitely worth keeping an eye on. There may be other medications. So if you want to know if your medication may be a problem for your tendon, have a chat with your doctor about that. Then if we get to the rehab part, either resting too much or resting too little can be an issue. For your tendon to settle down, your pain to settle down, and the tendon to be able to recover and repair itself, you have to temporarily reduce the activities you do. But if you just rest and you don't do anything, you really keep it dead still for weeks and weeks, your tendon actually loses more strength because your body thinks, well, you're not using it, why should we strengthen it? But the same thing, if you try to soldier through and keep on doing the things you normally do, you will continue to irritate your tendon, and then you may actually cause more damage. So it's really important to understand how to use relative rest, where you just reduce the activities to the correct level to allow your tendon to recover. And we have a video on that, so if you want to know more about that, have a look at the description of this one for a link to that video. Then if we look at exercises, either doing the wrong type of exercises, so for instance, if you have insertional Achilles tendonitis, if you're going to do lots of Achilles stretches, that's going to likely irritate it further. Or doing your exercises too often, not allowing your Achilles to recover, that can prolong your rehab plan. Also, doing exercises that's too strong for it, or just not doing enough, can have an influence. So if you're doing ones that's too strong for it, it will just irritate it. If you're doing exercises that's too easy, it won't bring about strength changes. So it won't be that useful to do them. So getting the correct exercises is important for your recovery time. And lastly, there is evidence that stress and anxiety in your life, it doesn't have to be about your injury, but just general work stress or stressful family situation or things like that, can actually increase the pain you experience and even continue to cause pain long after your injury has healed. How this works is basically when we're stressed, your body produces stress hormones called cortisol, etc., and the brain monitors those. Now, the brain can't distinguish between stress hormones caused by the injury versus stress hormones caused by normal life stress. It just reads that there's an increase in stress hormone. Now, because it knows you've been injured, it assumes the injury is getting worse, so it's got to create more pain. And that's why it can then, even though the injury is getting better, it can still cause you high levels of pain. So if you think that stress or anxiety may be contributing to your pain, it's definitely worth addressing that, because that can prolong your healing process. So what are the typical healing times for Achilles tendonitis or tendinopathy? Now, it's longer than regular injuries like muscle strains because your tendon has a slightly poorer blood supply, and it's also made of collagen fibers. And the process of renewing collagen fibers in the body is a lot slower than it is to renew muscle fibers, for instance. So best case scenario, it will take 12 weeks to recover and get you back to full sport. Now, how do you know if you're part of the best case scenario? It's usually cases where people have only recently developed tendon pain, so in the last few weeks, and they started on the correct mix of relative rest and strength training and all the treatments we've spoken about before. If you want to know what the correct treatment plan is, have a look. I've put a link to a video I've made about that in the description of this one that will explain to you what the research shows with regards to treatments that work, treatments that don't work, and treatments that you should really avoid. Although that's the best case scenario, the most common scenario we see is that it usually takes about 6 months to 9 months to get back to full activity in sport. And why is this? It's because, to be honest, people don't tend to look for treatment advice early on when the tendon first becomes painful. And the reason for this is tendon pain is quite intermittent at the start. It may be a bit uncomfortable after the day you do something, but then it goes away, comes back, goes away. So you often don't realize that actually this is getting worse. And when it's dragged on for several months, what the research is showing is that you actually get changes in the structure of the tendon. And again, I've made a video about that I'll link to here in the description of this one. And once you've got changes to the structure of the tendon, it then takes several months of consistent strength training to turn that around and get those new collagen fibers to be produced. So this is the most common case we see, is that people tend to search for help a little bit later, and it takes them about 6 to 9 months. Worst case scenario is that it will take you more than 12 months to get better. Now, we see this in cases where people's tendon pain has been dragging on for more than a year. So if your history is that you've had tendon pain on and off for a couple of years, 3 years, often people even email in and say, I've had my tendon pain for 10 years or longer, then usually the rehab process takes more than a year, so 12 months, 18 months, even 24 months of consistent rehab for you to get that better and get back to your full sport without pain. Now, this doesn't mean that you've got to see our lovely faces every week. What we tend to do is we try to teach our patients how to manage their rehab on their own, and that we only check in every 4 or 6 weeks, or when they feel that they've reached the targets they need to reach, to get more advice on that. So yes, best case scenario, 12 weeks. Typical, 6 to 12 months. Worst case scenario, likely more than 12 months, can be up to 2 years of consistent rehab to get that better. The last thing worth noting is that you have to remember your rehab journey will not be a straight line of improvement all the time. It is really common to have ups and downs in the rehab, because it's not possible to always pitch your rehab at the perfect level that you don't get flare-ups. So it's absolutely normal to make good progress and then suddenly your tendon is a bit more painful. That's fine. Just react to it. Take your foot off the pedal and give it a little bit of relative rest, and then slowly introduce your exercises and things again. A good physio will be able to help you adjust that, but we've also made videos about how to handle flare-ups because they are so common and they are part of the treatment or part of the journey here. So don't lose hope if you have a flare-up. It's normal, it's expected. You just have to react to it and you'll be able to make progress again when you come out the other side. Now, let me know if you've got any questions. And if you need more help with a tendon injury, you're welcome to consult one of the team via video call. The link to our website is in the description of this video. Take care.